Welcome to Rural Health Pulse. I'm Jim Kinnear, Chief Human Resources Officer at the Indiana Regional Medical Center. In this series, we focus on ideas and stories impacting the health of our region and explore the programs and initiatives designed to improve healthcare and wellness. This podcast is a collaborative effort of IRMC and Indiana University of Pennsylvania. In this episode, we are examining the challenges facing rural emergency management services. EMS is a critical part of the healthcare system, delivering life-saving care as first responders and also providing transportation to higher levels of care when every second matters. Rural EMS providers are facing an existential crisis due to limited funding and increased costs. Our guests are BJ Pino and Reba Johnson, representatives of Citizens Ambulance Service based in Indiana, Pennsylvania. In this episode, we are speaking to BJ Pino and Reba Johnson on the topic of rural EMS. To get us started, I'll ask each of you to introduce yourself and just share a little bit about your background and your role with Citizens Ambulance. BJ, would you mind starting?
Sure. First of all, thanks for having us on this podcast. This is an interesting approach. I've been with Citizens Ambulance Service longer than I think I want to admit. Not only that it just gives up my age, I guess, but I've been there for, I think, in a full-time capacity in my 46th year. So it's been a great journey. And something that's kind of unique is the sense that I came into the organization when emergency medical services was really starting to take form. And so it was interesting for me to be at the ground level and to have seen how it's basically come about in the last 4 decades. So it's been an interesting journey.
I'm sure it has been an interesting journey. It'll be interesting hearing some of your perspectives about the changes over the years as we talk a little bit further here in the podcast.
Sure.
Reba, could you introduce yourself, please?
Yes, I have been with ASMC and Citizens Ambulance for 23 years. It was actually this September. I came in with having no understanding of EMS, and in my role as the Human Resources Director, which was actually a good thing. So I learned, as I do with many things, from the ground up, getting to learn what that looked like, the system process, the different challenges that they face as employees, and the things that we have to do to support them through human resources. My duties also encompass safety and training, as well as what you would consider to be the traditional HR responsibilities, employee development, management, leadership development, those kinds of things as well. So it's helpful that I've been there as long as I have, but have gotten to see how the industry itself has changed, and how that has changed how we respond to and advocate for the employees that do the work that they do for EMS.
Thank you, Reba, and I'm sure we'll have some interesting thoughts and questions for you as well with some of the HR and workforce challenges in this field. To get started, BJ, would you provide us with a brief description of what is the state of rural EMS today?
Well, I think I would be remiss if I did not keep it consistent with what we're seeing other people reporting. I am comfortable telling you that emergency medical services is in a crisis situation. We've not seen the severity of this in quite some time, where we just do not have the necessary people that we need to operate emergency services, plus the financial stability is really critical at this point.
What are some of the main reasons for this crisis in EMS?
From a financial perspective, which leads everything, let's face it, we have to continue to train people, but in order to do that, you still have to make emergency medical services be viable, and it must appear as a professional service, and it has to be a profession. In order to do that, you've got to pay people adequately, so that they can achieve their goals, and subsequently, if they choose to move on, whatever, it's no different than any other business. And sometimes that's a problem with emergency medical services or even public safety. It isn't viewed as a business. Unfortunately, it is. It has a budget. It has the expenses that have to be met. It's no different than anything else. We just assume it shows up. We assume it's there, but we don't think about the depth of what it actually takes to make that happen. So the biggest challenge continues to be with the pay and the payer mix. For years, we have been based on the simple fact that we're transportation. We are not just simply transportation. We do a myriad of other life-saving skill sets that, for all intents and purposes, are essentially ignored when it comes to a fee schedule or how we're reimbursed via call. So that is one of the largest things that's at the root of this whole process. The other thing that I would say just out of the chute when it comes to the Commonwealth that we have, the role and responsibility of designation of emergency medical services and subsequently the funding for that falls at the municipal level. And this is something that is really difficult to be able to open discussion on when for years municipalities had no need to worry about that because it was being provided for them at no cost.
Thank you for sharing that. As we think about those costs, individuals may be just thinking about that episode of care, coming out and providing care at the scene and transporting the person. But I've heard this term cost of readiness, and I was just wondering if you could just expound on that a little bit and help everyone understand what that means and why that's important.
Absolutely. Cost of readiness is the amount that it takes so that the crew that does ultimately respond to your emergency is sitting there waiting for that to occur, if you can comprehend that. That really gets more complicated in scenarios outside of urban and especially in the rural context like we're talking today, because that cost of readiness continues to escalate because there's less call volume that can support the actual operation or to quote unquote have that crew sitting there 24 hours a day waiting for someone to call 911 and say, I need help.
I think you briefly alluded to some of the funding challenges, but at a very high level, what are some of the necessary changes to stabilize rural EMS?
Definitely increase in reimbursement from the payers. For the payers to also view us as not just simply transportation, and to make that fee schedule, as we mentioned, to reflect that. As you know right now, in many of the things that we do, if we do support a patient and we do care for a patient, whether in a traumatic or medical emergency, if we do not transport that patient, we don't get paid, or at least paid to at least cover the expense of us going out the door. So that's got to change. The other thing that has to change is that we need support to allow our workforce to be developed, that they have a future, that they do and are treated as professionals. They should not have to work 3 jobs to make ends meet. They should not have to be looking at, well, I'm only here until I could go to nursing school or I can do this. Sure, we're happy to take those folks coming on their journey, and we love doing that, especially at Citizens Ambulance Service. But we also need to look at this as public service. They are no different than police, fire. EMS has got to be up there too, and it's got to be supported adequately.
Thank you. Just as a follow-up, when we were talking earlier about cost of readiness,
Yes.
I think what I heard you say there is we have to consider the cost of being prepared for what may or may not happen. And part of that financial trade-off is how many resources can you put forth and what is maybe an acceptable response time.
Correct. Response time has always been a measurable effect in emergency medical services, always. But there's great debate as to, what is acceptable, what really changes lives. Let's just face it this way. We all know that death occurs within minutes. especially when the heart stops and breathing stops. So in the most critical emergencies, getting someone to the patient in immediately changes lives, and it saves lives. So that encompassed also now with all of the advanced care that paramedicine can do, especially with stroke patients, and we're getting better outcomes because we're getting those patients to the facility that is caring for them where they need to be and getting them there at a great or a higher level of care at that juncture and getting them in a salvageable condition to that emergency or to further into the cardiac labs, directly into those. These things are changing lives. And that is all based on the critical and emergent response of the necessary services. So response times is measurable, but we also need to look at the quality and the quantity of that response. I've always been a firm believer in basic life support. ABC, airway, breathing, and circulation. If something is impeding, we've got to change that. We've got to address it immediately. That saves lives. That's why you develop things such as immediate response personnel networks. You do those in conjunction with people in outlying areas. You do it in conjunction with fire departments that can respond immediately ahead of the ambulance. All of that is, especially in a rural environment, is what gets us the response times that we need to sustain life.
Thanks for expanding on that. And as you said that, I was just thinking of the elements of having the right person or provider with the right resources at the right time.
That is exactly true. And too many times we think that when you start looking at cost values and you start looking about how do you really, how do you afford this, you have to regionalize it. And when you do that in a rural context, it really takes element. That's really how you have to approach this. In the old days, we'll call it old days. Again, I'm dating myself, but you wanted an ambulance on every street corner. That's just not financially possible. And quite honestly, it's not necessary. Because if you tier the system and the response mechanism appropriately, you'll get the response that you need when you need it. It just needs to be supported and it needs to be sustained. That encompassed with the whole systemic approach. EMS cannot stand by itself. If anybody views any type of healthcare, quite honestly, that it's standalone, I think it's somewhat distorted. It has to be part of a network or a system. Recently, we talked about our trauma response to a mass shooting in White Township. Everybody was involved. Citizens Ambulance Service, of course, but hospital, external resources, police, fire, everything was there and everything worked. And that's what success in emergency medical services is. EMS cannot stand by itself.
That's a great point. Thank you. We're going to turn a little attention to some of those workforce issues you were talking about earlier. And I just want to ask, Reba, in your role as the Director of Human Resources, just if you could give us some perspectives. We know many sectors of healthcare are facing workforce shortages. What's the situation for you in EMS?
Of course, we're facing the same shortages. And as BJ alluded to, what we're seeing is a change in the culture, if you will, of the workforce that that are coming into EMS or that are working in the field. There's been this shift of interest in staying in the field because of a sense of public commitment, public service, to where we, and primarily because of where we're located, and we're blessed to have IUP right in our backyard, who does most of the education of basic life support EMS providers, of EMTs, that are going to be here for 3 or 4 years or however long, and they're looking for employment. So it's a ready fit for them to have that and to get that experience. So we've always known that there was a benefit to having those people that could come, be here for 3 or 4 years, work, and then they're going off to other things. But we also counted on that idea of community involvement, people who are dedicated to field because they want to be part of the public support for providing the service to actually enter the field. And that's where we're not seeing as much. Whether it's because people are migrating to other areas, they don't want to stay in the rural environment. A lot of the younger or even other families, now they're more mobile, so they want to do things where they have access to other environments, more urban or what have you. Those kinds of things that hurts rather, for finding people that want to do this and stay in the area. And quite frankly, you don't see a whole lot of movement of people saying, hey, I want to move to Indiana County. I want to leave where I am to come to, rural Pennsylvania, Western Pennsylvania, to be here, and that's obviously something that has changed the workforce that we are attracting.
Interesting. What are some of the strategies that you're looking at to help address some of those challenges?
Well, number one is, not taking what we can, but by all means, being grateful for what we do get from the students and the others in the area that may only be here for a shorter period of time, and using them as our best resource for getting the word out, to keep that pathway going, to keep that pipeline, if you will, going, of people who start to think, oh, well, I'm not going to school for nursing, but I could be an EMT and it would still benefit me when I'm a business manager or a safety science person or something. So using them as our number one resource for getting the word out and proudly showing that they're part of the organization while they're here. That's one of the best strategies that we use. The other is just making sure that being a small community, that we're as visible as we can be, to just kind of keep that mindset there, that, we are here, it matters, having those conversations with people who show that appreciation for EMS in the community.
Thank you for sharing that. Any particular ways of increasing visibility that you've found to be most effective?
A little bit of everything. Social media and some of the other things of that nature really, really helps. And realizing that different forms of social media speak to different audiences. So making sure that we are targeting that message to get through to who we're speaking to through that medium. Facebook people are a different group of people than TikTok or Twitter or whatever it's called nowadays, and Instagram and those kinds of things. So making sure that we tailor that message to speak to each of them so that we're trying to get their attention.
Thank you, Reba. As you're thinking, I'm thinking as a fellow HR professional that maybe in the future marketing should be a required class for all HR professionals, because I think we spend a lot of time marketing.
Yes, absolutely. And you learn something every day. I'm fortunate to have a 20-plus something person in my household. So, I'll ask her, hey, what is this Twitter X thing? How does this work? So it's also just realizing that, we can't age ourselves as HR professionals. We have to stay current on a lot of those things to make sure that we're speaking the language that speaks to the audience we're trying to reach.
Have you found any importance to partnerships, like working with IUP and other training providers to help with that workforce supply and demand issue?
Oh, absolutely, absolutely. And here in Western Pennsylvania, we have our EMS region, which is out of Pittsburgh, EMS West. And there was actually a initiative that we started for recruitment, giving us some branding and other materials to help, especially some of the smaller agencies, EMS agencies that wouldn't necessarily have access to a lot of that, to try to support each other in finding out the best ways to get the word out to the public, and to also equip our current EMS professionals with tools that they could refer people to find out information. What does it mean to be an EMT? What's the difference between an EMT and a paramedic or an advanced EMT, those kinds of things.
That's great, and I can imagine those collaborative efforts are really important. And we've covered some pretty serious topics today, and I want to end on a positive note. So I would like to ask each of you, what are you most proud about in regards to Citizens Ambulance? Whoever would like to start can jump in.
I think I like what I've found over the years that I've been here, again, coming in as someone from outside the field, which quite frankly was a little unusual for the organization, which is greatly steeped in history, having been here for almost 60 years, is the recognizability and the respect. When you're in the public and you're whether representing the organization or just going to Walmart to pick up a loaf of bread, I happen to be wearing a T-shirt or something that has it. There's so much willingness for most people in the community to say thank you, to recognize, oh, I know someone that works there, that kind of thing, to start that conversation. And for me, that is something that reaffirms to me that what I do, even though I'm not out in the streets doing the work that all of our professional practitioners do, I'm a part of that. I'm a part of that chain, that cycle of the healthcare continuum that they're a part of, and where it starts in pre-hospital care.
Well, thanks for sharing that, and I can hear that pride in your voice, and well-deserved.
Thank you.
BJ, anything you'd like to add?
Well, before I wrap it up, I would like to comment about the whole aspect of emergency medical services. I have seen more written on EMS and its concerns and issues in the last year or so than I've ever seen, which is good. And I would ask the listeners to become engaged, ask questions. Please know, look and see what is available to you in your community. Don't just assume that public safety or any public health entity is up and ready to respond to your need. You must be well informed. Also encourage government, also encourage municipal, state, and your commissioners, most supporting this type of quality of life, if you will, to be engaged and to question what is available to us when we need it. And there is a great group of folks, too, that have their own website. It's called CC4EMS. And they give us a nice cross-section of both of both rural and urban expertise. It's a group of professional individuals that have dedicated themselves, and many of them in retirement, to make sure that they're making the public aware of the situation that's going on in EMS. And they've got some great suggestions for lobbying, and they've got some great suggestions on how communities and individuals can become more active and being educated appropriately and accurately as to really what emergency medical services is in the Commonwealth of Pennsylvania and beyond.
Can you share that website one more time?
Sure. It's CC4, the numeral 4, EMS. And I guess I would have to say, as far as the happy point, is that what you wanted?
Yeah, point of pride, something that...
Well, it's the people that I work with and have worked with. Reba talked about being steeped in history, and this organization certainly has been. I've been blessed to know some tremendous leaders in this industry and helped shape and form, what we know as public safety today. And our community has many of those people in retirement, and they still are active trying to take care of other people and just keep this whole semblance of community helping each other. So that's the first sense of pride, is seeing these youngsters working out there every day of the week and at the level in which they do it. And to see the end result on occasion, as we've had together, both Indiana Regional and everyone else, where we've seen the end product, where we saved somebody, or we made life better for someone when it was really pretty dark. So That's what the satisfaction is. Healthcare is to take care of each other. EMS is a great component of healthcare, and I'm only hoping through dialogue like this that people understand it's a lot more involved in your healthcare picture than what you might think. It's not just the portal to your emergency room visit. It needs to be taken care of so it's there for you when you need it.
Thank you. And I know emergency room providers appreciate and value everything that's done by EMS professionals because they bring individuals there, but they're sustaining them. They're ensuring that they're able to be there to receive the care. And it's often those critical moments. And I think those critical moments are the times that if we need a reminder of what we're fighting for, we know that's what it is.
And you can have my full that respect is mutual.
Well, thank you both very much
Thank you.
for joining.
Thank
We
you.
appreciate you taking some time out of your schedule. And we look forward to hopefully hearing continued progress in moving ahead and addressing some of these challenges with EMS.
Thank you, Jim.
Thank you.
Rural EMS is a vital part of the healthcare safety net. Continued efforts are needed to ensure the continuity of this critical service to our communities. Rural Health Pulse is a collaborative effort of the Indiana Regional Medical Center, Indiana University of Pennsylvania, and the Indiana community. It is produced by Chris Korn from IUP's Division of University Advancement and recorded by the IUP Communications Media. I'm Jim Kinnear. Thank you for listening, and be sure to watch for future episodes of Rural Health Pulse.